All right, everybody, welcome into chapter 19. Today we're going to talk about bites and stings. Before we get started, I just want to remind you all a little caveat. There is a lot of material in this chapter. You will not be tested on even close to all of it. So I may go through rather quickly. Because this is a video, feel free to pause, go back, rewind. Whatever you need to do to make sure you understand this information. It is helpful for your life, okay? But as far as for testing purposes, there's not a ton of information that's going to be on the test. So take that for what it is. But as we go through this, I'm going to be going kind of fast. So just be aware of that. So animal bites. There are two concerns that come from animal bites in general. For one, the tissue damage that occurs, and two, infection that can occur from the microorganisms that may enter the wound. Dogs are responsible for most animal bite injuries, so we'll kind of focus on some of that, but we'll talk about some other ones as well. Children or older people are most prone to animal bites, mainly because they don't move as quickly or they may not be aware of their surroundings. They also may not have the strength to fight off an animal if it comes at them. Most damage occurs to the hands, arms, legs, and face, mainly because that's what you use your arms, hands, and legs to protect yourself. So those tend to get attacked fairly regularly. Wild animal attacks occur most often in rural or wilderness locations, so knowing where you're at is going to increase the risk of these types of injuries. So we'll quickly go over rabies. Rabies is an ancient feared disease that everybody's heard of, right? Here in Utah, really the only animal that is prone to have rabies that we will have are bats. And you don't even see them very often. Most of the time, bats kind of keep to themselves, and they're in dark places that humans don't tend to frequent. Okay? Rabies is caused by a virus that's found in mammals, warm-blooded animals. A bite or a scratch is considered exposure if it penetrates the skin, so any sort of an open wound. Non-bite exposure usually happens when the wound is contaminated. Okay. You should consider an animal rabid or consider it to have rabies if it's made an unprovoked attack, if it acts strangely, if it's a high-risk species. Okay, and we'll talk about, those high-risk species are those ones that were on that graphic a few minutes ago: raccoons, bats, skunks, all of those. Okay, report any sort of animal bite to the police or animal control. The reason we do this, for one, is to get you care, but also we're trying to prevent risk to other people. So, if a dog bites you and it's somebody's dog, that's somebody's pet, but at the same rate, if that animal is going to bite somebody else, that's not safe. Okay, so we need to protect others as well, especially if it's in a public place. Now, if you provoked the attack, right, like you went in somebody's yard, well, that's your own dang fault. Okay, so in my opinion, that's kind of a different situation, but take that for what it is. So things to look for: there's obviously, with a bite, there's going to be some sort of a puncture wound from the teeth. A lot of times it will crush the skin or the tissue, and there will often be open wounds like on the fingers, knuckles, and or hands. As far as how to treat an animal bite that's broken the skin, you're going to apply direct pressure to try and control bleeding. If it's a shallow wound, wash it out with soap and running water. Flush it out with clean water to try and remove any debris. Cover it with an antibiotic ointment and a dressing. If it's a severe bite, you should take the patient to a medical facility to have it cleaned. For a bite that didn't break the skin, apply an ice pack for 20 minutes. Use rice. A wild animal bite, don't try and capture the animal. Don't kill the animal. Just contact the local health department. If you're out in the wilderness, right, like you're in their territory anyway. So be aware that trying to kill that animal may not necessarily solve the problem, okay? Just because, I mean, the biggest problem is if you try and kill or capture the animal, you're at risk of also getting bit. And two emergencies, creating a second emergency doesn't resolve the first one, okay? Human bites. So, this is a big one. There's quiz questions on this, so make sure you understand this about human bites. Human bites actually are more severe than animal bites, and we'll get into a little bit more why. Most of the time, it's a cause of some sort of a fight, okay? Whether somebody was trying to inflict violence on somebody and somebody was defending themselves, or somebody was aggressive and bit, that's usually what it comes from. The most common injury is the most common location that a human bite occurs is on the hand. As far as what to look for, there are 3 different types of bites. So a true bite is when there was flesh that was caught between the teeth. A clenched fist injury, so that's usually when somebody punches somebody else in the mouth, and the teeth cut the person's skin that was doing the punching. Okay, and then you have a fight bite. A fight bite is a bite that occurs during a fight, which is probably most often what you're going to see. The real risk behind human bites is the human mouth is disgusting. Okay, because we actually have more bacteria in our mouth than most animals do. That's why your breath stinks if you don't brush it, if you don't brush your teeth, and that's why we get cavities and such. So, if you get bit by a human, the risk of infection is very high. Excuse me. Now, a fight bite, the reason it is the most prone to infection is because in a situation where somebody's adrenaline increases, the amount of bacteria in the human mouth also increases exponentially. So the risk of infection is very, very, very high. So that is a quiz question. Make sure you understand that a fight bite is the type of bite that is most prone to infection. Okay. As far as what to do, if the wound is not bleeding heavily, wash it with soap and water for about 5 to 10 minutes. Flush it with running water that's under pressure. This is a quiz question, so make sure you're taking note of this stuff. Try and wash it out with water with pressure to clean out any debris. Apply an antiseptic solution like alcohol or hydrogen peroxide, something like that. Control any bleeding with direct pressure. Cover it with a sterile dressing, and then seek medical care. Now we're going to move on to some specific animal bites, snake bites. Snake bites lead to as many as 9,000 emergency department visits every year in the United States. Now, an interesting fact about that is that venomous snake bites are only about 1/3 of those visits. So a lot of people get bit by snakes. Not near as many of those, a very small percentage of those are actually venomous. Only about 1/3. Okay. So, there are 4 species of venomous snakes in the United States. They're considered pit vipers, except for coral snakes. Coral snakes is the exception. But these 4 are venomous: rattlesnakes, copperheads, water moccasins, and coral snakes. When it comes to identifying vipers, okay, and venomous snakes, these are some important factors, okay? And there's another slide on this later. But as far as identifying a venomous snake and a non-venomous snake, okay? So, pit vipers or venomous snakes tend to have a triangular-shaped head. Okay, not tend to, they do. Their tooth and their fang patterns look like parentheses, and they have 2 fang marks in the front. So these are bigger than the rest of these teeth marks. Okay, they have fangs like this, They also have a pit right behind their nostril, and they have a very flared nostril. The pit is there for to help with their sense of tracking heat. Okay. The eye has an elliptical pupil, so a long, straighter pupil. When it comes to non-venomous snakes, they have a rounded head. Their tooth pattern looks like a horseshoe, okay, because there's teeth here on the inside as well. There is no fang marks. They don't have fangs. They have a single nostril. It's not flared like you have with the pit vipers. Their eye is round and their pupil is round. Okay, so those are some things to differentiate. Now, a coral snake is a little bit different. We'll talk about that when we get there. There is a quiz question on this, so note this information when you get to the quiz. Okay. So, snake bites are painful. They can be costly, and they're potentially deadly if they come from a venomous snake. It can lead to loss of an extremity or finger, or loss of movement in a joint. Most people recover just fine as long as they're treated appropriately. So, like I mentioned before, rattlesnakes, copperheads, and water moccasins are pit vipers. Okay, the reason they're called pit vipers is for that little pit that I showed you in the picture earlier behind their nostril that senses heat. Okay, coral snake is not a pit viper, but it is a venomous snake that is in the United States. Now, I'll show you the map on the next slide. Coral snakes aren't really in Utah, but they are small, they're colorful, they have a series of bright red, yellow, and black bands around their body. Now, there is a species of snake that looks like a coral snake, but is not a coral snake, and it's non-venomous. It's called a king snake. So really, it's the pattern of the colors that determines whether it's a coral snake or a king snake. And I should probably put a picture of a king snake on here. But if you'll notice, on a coral snake, this is a coral snake, the red touches the yellow band. Okay? So the saying goes, red touches yellow, kills a fellow. Red touches black, venom lack. Okay? So if the red were to touch the black band directly, then it would be a king snake, and those are non-venomous. Okay? So, ready? Red, black, not venom. Wow, that is beautiful. Okay? Red, yellow, venom. Danger. Do not cross go. Do not collect $200. Okay? That's how you tell the difference. Now, as you'll notice from the map here, in Utah, really the only types of venomous snakes that we have in the U.S. are rattlesnakes. But as you go south, you can get coral snakes here in Arizona and into Mexico. Water moccasins are really in the Middle East, and then over to the eastern United States. Copperheads are really in the southeast U.S. Okay, so rattlesnakes are the ones that we're going to be the most worried about. So there are two different ways to classify bites. You have accidental snake bites and then provoked snake bites. For accidental snake bites, typically the person doesn't see the snake, and so they're bitten before it was recognized. Usually they're bitten while they're trying to move away, or run away, or as they're walking type of deal. So a lot of times these can come with some tearing of tissue, and they can actually be more hurtful. Okay, most often they're going to happen on the lower extremities because the person's going to be upright walking. They're not going to be down looking at the snake, those types of things. And of course, as comes with the name, they're accidental. Provoked snake bites are most often going to happen with people who are trying to play with a venomous snake, don't realize that it's venomous, those types of things. The person recognized the snake and they were down looking at it. They did not attempt to move away. Most of the time, what you're going to see with these is it's going to happen on the upper extremities, like on the hands or on the arms. Okay. Usually it's when a person tries to kill, capture, or play with or move a snake. So that's why most of the time you're better off just leaving the snake alone. If it's in a public area where somebody else could be at risk of an accidental snake bite, just call the local authorities and they'll get it taken care of. So again, talking about pit vipers, they are found in every state in the United States except for Alaska, Maine, and Hawaii. Rattlesnakes are the most widespread, but they're not all bad, okay? Rattlesnakes do help, pit vipers do help keep the rodent population under control, so they're not all bad. So that doesn't mean you got to kill them all. That doesn't mean you got to get rid of them all, okay? Now, if they're in a public place that's going to be a danger to other people, right, like if we're entering their territory, that's their territory. If they're entering our territory, it's our territory, and we would like to relocate them for the safety of everybody. Okay? So, this is a quiz question. Make sure you understand this. These are some signs and symptoms to look for that would differentiate between a non-venomous snake bite and a venomous snake bite. So, for venomous snake bites, there's going to be a severe burning pain. There'll be 2 small puncture wounds, like you can see here. Because if you'll remember, pit vipers have fangs, non-venomous snakes do not. Okay, or should I say, venomous snakes have fangs, non-venomous snakes do not. Include coral snakes also have fangs. There's going to be some swelling around it, and it's going to be a little more severe, right? Like if you get a cut, it will swell a little bit. Just a normal cut that's not even necessarily infected. Okay, a non-venomous snake bite might swell just a little bit. But the swelling for a venomous snake bite is going to be different, right? Like this is really swollen. That's not normal, okay? There will be some discoloration. It can go black. You can get blood-filled blisters like this one. But you a lot of times, one of the immediate, maybe not necessarily immediate, but one thing when it comes to evaluating danger of really any type of wound, those types of things, we're looking for systemic symptoms versus local symptoms, right? Anytime it's starting to cause body-wide symptoms, right? Like if I get a cut on my foot and all of a sudden it's making me nauseous, right? That has nothing to do with my stomach. It's a long ways away from my stomach, so there's likely some sort of infection that is occurring with that. Snake venom will do that, will cause systemic symptoms. Okay, is what we call them. Full body symptoms, not just local symptoms near where it happened, right? A bruise, a little bit of swelling right near where the wound happened, that's local symptoms. Things that are happening away from that, sweating, weakness, vomiting, those types of things are, in fact, systemic symptoms. Okay, that's a quiz question. Make sure you understand that. As far as what to do, get the person or any bystanders away from the snake because we don't want somebody else to get bit or that person to get bit twice. Try and get the person to rest and stay calm and be still. The more excited or the more panicky they are, the quicker their blood flow is, the higher their blood pressure increases, and the more the venom's going to spread, and we want to try and risk that, okay? Don't try and kill the snake. You don't want to get bit as well. Try and remove any jewelry or tight clothing from the bitten body part. As you remember from the previous slide on that picture, it will swell. If it's on a finger and there's a ring on that finger, that's just going to make the problem even worse because then they're going to lose all blood flow to that finger, and lack of blood flow leads to tissue death. Gently wash the bite in soap with running water to try and clean it out the best we can. Apply a sterile dressing over the fang marks, and we're going to call 911. Get this person some help. Okay. Another thing you can do, use gravity to your advantage. Don't elevate the body part like maybe you normally would with a wound, because we do not want gravity to help the venom get back to the heart, right? We're trying to keep the venom where it's at. Okay, we don't want it to spread. So for coral snake bites, they're just a little bit different. It is the most venomous snake in America, but they rarely bite people. The difference is their venom is a neurotoxin, so it affects the nervous system. more than these other body systems, and we'll talk about that on the next slide. Symptoms typically begin anywhere from 1 to 5 hours after the bite. As far as what to look for, several hours may pass before these start, but look for things like nausea, vomiting, sweating, tremors, drowsiness, slurred speech, blurred vision, swallowing difficulty, and breathing difficulty. As far as what to do, apply a wide elastic bandage, try and compress it. Try and stabilize the bitten arm and keep the arm or leg below heart level to prevent the spreading of the neurotoxin, the venom. Do not cut the skin or use suction. That's kind of an old thing that used to be recommended. Oh, suck out the venom. That's not effective. Okay, it's not effective, nor is it very safe for the other person, as they can have some of the same symptoms. Okay. So non-venomous snakes bite people most often. Okay. If you don't know what type of snake it is, assume that it is venomous. Okay, but just remember, if you can get a good look at the snake without getting bit, okay, then you can kind of have an idea, use those criteria that we've talked about. As far as what to look for, the bite marks are often going to be horseshoe shaped. It is going to bleed more than a pit viper bite will. Okay. There may be some possible swelling, mild itching, and tenderness. But again, these symptoms are all going to be local. They're not going to be widespread full body symptoms. Okay. So if you get a question on this on the quiz, make sure you understand, okay, you can get some bleeding from a pit viper bite, but it's not going to be as widespread as with a non-venomous bite. Okay, so bleeding is not going to be an eliminating factor for a venomous versus non-venomous snake. Okay, some of those other things like the shape of the tooth marks, right? Those are going to be an eliminating factor. If it's horseshoe, it's definitely non-venomous. If it's not horseshoe, if there's fang marks, it's definitely going to be venomous. Okay, so keep that in mind as you're answering that question. It's not a trick question, just it's evaluating your understanding of the material. Okay, as far as what to do for a non-venomous snake bite, gently clean it. Care for the bite as you would just a normal shallow wound. If it's severe, if you're starting to have some sort of a severe reaction, consult with a physician. Okay. Again, if you don't know whether it was venomous or non-venomous, look for some of those symptoms that we talked about before. You may not need to go to the doctor right away, but if you start to get some sort of systemic symptom and you're worried about it, just go. Okay. So some other reptile bites, we do have. Oh, I thought there was a map on here. In Utah, we don't have either one of these. Okay. A Gila monster or a Mexican bearded lizard have venom. Venomous lizards, the difference between lizards and snakes is they may hang on, okay, and continue to like chew on the person to get venom into the person's skin, so they may not come off right away, okay. So the biggest thing about these other, well, we'll talk about that on a couple slides. What to look for: puncture wounds, swelling and pain, sweating, vomiting, increased heart rate, shortness of breath. For the venomous bites, we're looking for those widespread symptoms, systemic symptoms. Okay. As far as what to do, give them over-the-counter pain medication. If you believe it was a venomous reptile, call 911. Okay. Treat the bite the same as you would for a pit viper bite. If the lizard is hanging on, okay, then the best thing to do, okay, is try and get behind the lizard, grab it around the neck, and try and choke it out. Okay, that sounds really silly, but the reason you would do that is because if they're not going to let go and you try and pull the reptile off, it's just going to cause more and more and more damage to the person's body tissue, okay, or your body tissue if it's you. So you want to get it to release its bite. You don't want to pull it off, because that's just going to cause more damage. Now we're going to talk about some insect stings. We'll talk about bumblebees, honeybees, yellow jackets, hornets, wasps, fire ants, and some of the differences. I say this in every lecture. I am of the opinion that wasps, hornets, yellow jackets are the spawn of Satan because they offer no benefit to the human race. So, we hate them, we don't like them. We try and get rid of them every chance possible because they don't have any sort of a purpose. Okay, moving on. So insect stings. About 0.4 to 0.8% of children and 3% of adults have some sort of a life-threatening allergy to insect venom. Generally, venomous flying insects are only aggressive when they're threatened, except for wasps because they suck and we don't like them. They just tend to be aggressive because they're jerks. Okay? Honeybees. So honeybees have barbed stingers. The difference between a honeybee and some of these other flying insects, honeybees, bumblebees, and these other flying insects, is that they die after they sting. So most of the time, it's like a last resort for them to sting you. So that's why they don't do it very often. Some venom will remain in the stinger when it's embedded in the person's skin. That venom worsens the person's reaction, so that's why you have to remove the stinger. And we're going to talk about how to do that in a little bit. So stings from wasps, hornets, and fire ants, they don't have a stinger that embeds in the person, which means they can sting you multiple times. And most of them are not going to die after they sting you. Again, spawn of Satan, terrible. Okay, fire ants may offer a slight benefit to society, but it's not very large, so I don't love fire ants either, but I don't hate them as much as wasps and hornets. Okay, yellow jackets. Two types of yellow jackets. A wasp can sting you multiple times, whereas a ground nesting bee, they will only sting you once and then they die. But their nests are in the ground. So we do have some of these in the mountains here in Utah. I had a run-in with them when I was like 10. Had one fly up my pants, bit me on the leg. It hurt, sucked. Not fun, okay? But they are smaller than regular yellow jacket wasps, so you got to watch out for them. So most reactions to insect stings are very local. They cause an immediate inflammatory reaction that will go away after a day or two, and you can treat it with like over-the-counter stuff. So it'll be painful, itchy, red, swell. So these are like fire ants, right? Look like little pimples. They hurt, they suck, but they do go away, and they don't really cause any life-threatening reaction. Now, life-threatening reactions to insect stings come when somebody has an allergy to these stings. Usually it's going to be an anaphylactic reaction. Generally happens very, very quickly, will lead to throat swelling, bronchospasm, and it threatens the respiratory system. Can also lead to nausea, vomiting, wheezing, fever, and a drippy nose. Okay, so you would treat this person just as you would a normal anaphylactic allergic reaction. Okay, use an EpiPen, things that we've kind of talked about before. Okay, so I did want to quickly mention this. Even if somebody is not allergic to a honeybee, 500 stings, which is a lot because it doesn't happen very often, but 500 stings will usually still kill somebody who is not allergic to stinging insects. Again, very rare, it doesn't happen very often, but it does happen. So if you're going someplace new, if you're going out hiking, things like that, make sure you do your research before you go. Ask questions to the people who have been to the area. Research before you just go, okay, to know if that is a risk. If you see a nest, avoid it. Don't go messing with it, right? That's their territory, not yours, okay? If you do happen to have a massive nest near where you're living in a public area, call local authorities to get it taken care of. They have the equipment and the means to do that without getting stung 500 times, okay? The other thing I wanted to quickly mention, I actually didn't know this before, but I recently researched it. Africanized bees are also known as killer bees. So the killer bee is like, it's a result of humans messing with things they shouldn't. So in 1956, okay, somebody thought it was a good idea. I don't know who, but they decided to take the East African lowland honeybee, okay, to Brazil to try and increase honey production in the area. Well, some swarms escaped and they crossbred with other types of bees, and they created the killer bee or the Africanized bee. So killer bees are very different from other types of flying venomous insects. Killer bees are very aggressive, they are very defensive, and they will chase you, right? Like most bees only sting in defense and will stay near their nest, and they won't like chase you. Killer bees are known to chase people up to a quarter mile. So, and they tend to attack like in packs. So these like 500 stings things, these stories most often happen with killer bees. So if you know you're going to go someplace new, try and research, make sure you're not going somewhere with killer bees. If you're going somewhere with killer bees, watch out. Maybe carry some wasp spray with you. I don't know. But kind of scary. So insect stings, the biggest thing is not everybody's responses are the same. Again, stings to the mouth or the eye tend to be very dangerous because there's likely going to be some local swelling, and swelling in those areas can be dangerous, can cause problems. Again, multiple stings tend to cause more problems than a single sting. The most dangerous type of single stings to people who aren't allergic are if it happens inside your throat. So, as most of you probably know, going throughout the summer and such, you know, when you go to events and you have foods outside, bees tend to swarm around. They're kind of attracted to that kind of stuff, right? So you watch for it on your food. Don't swallow a bee. That's not good. Okay? So as far as what to look for with insect stings, most common reactions are instant pain, redness, or itching. Things that might be worrisome: hives, swollen lips or tongue, a tickle in the throat, or wheezing. And then life-threatening reactions, things that come with anaphylaxis: blue-gray skin color, seizures, unresponsiveness, or inability to breathe. So what to do? This is a quiz question. As I talked about earlier, if you get stung by something that leaves its stinger there, okay, do not use tweezers to pull it out. You're going to use a knife or something with a sharp edge to scrape it out, because if you grab it with tweezers and squeeze the stinger, it will release more venom into the skin and create a stronger reaction, right, and more prolonged. So that's a quiz question. Make sure you know that. Wash it out with soap and water. Apply an ice pack to try and slow down the local reaction, the local inflammation. Give pain medication if necessary, and you can apply hydrocortisone cream or give an antihistamine like Benadryl to help lessen the reaction. If somebody is having a severe allergic reaction like anaphylaxis, help administer an EpiPen. Monitor their breathing. If they stop, give them CPR. Have the person suck on some ice if they have a sting in their throat or their mouth to try and slow down some of the swelling in the area, slow down the blood flow. And then, of course, if somebody has a very severe reaction, call 911 immediately. Next type of bite we're going to talk about: spider and other insect bites. So most spiders do have some type of venom, okay? There are about 60 species in North America that are capable of biting humans. This is why I also hate spiders. In Utah, we do have hobo spiders. We do also have a lot of black widow spiders, which we'll talk about, but they're not included on the map. I'm not sure why. That will explain. The figure right there mentions that black widow spiders are all across the U.S., so why include them? Because the whole map would be that color. So, but as far as brown recluse or hobo spiders, we do also have hobo spiders in Utah. We don't really have brown recluses. Okay, we'll talk about those in a minute. Black widow spiders, also known as brown widow spiders and red-legged spiders. Most of them look through this. Most of them, look like this. These are the ones that I've seen. There's only three of the 5 species are actually black, but most of them look like this. They look like the spider from your nightmares. They have long, spiny legs, a big butt with red spots. Like it says, they can actually be brown as well. Okay. The reason they're called black widows is because the female is the larger of the species, and they're called black widows because after they mate, the female typically will kill the male. So they become, in theory, a widow, even though it is by their own causing. Don't ask me why. Fangs can penetrate human skin. Their abdomen and their skin is usually shiny. They'll have a red or a yellow spot or white spots or bands on them. They have a very potent venom. Their web is typically not like your typical spider web that you would think of. It's not very uniform. It's like, almost looks like cotton, right? And generally they hang out in dark spaces. So for example, at my house that I grew up in, we had a tramp that we buried in the ground and we put cement underneath it. We included like a crawl space to get underneath the tramp if you needed to, like a little hole that extended off to the side, that we just put a board on top of. Well, in that little hole that was very dark all the time because it had a board on top of it, there was like always black widows hanging out in there, and we'd have to spray them pretty frequently. Okay, so generally they're not out in the open, they're in dark spaces. So when you go digging through stuff like in your garage, those types of things, make sure that you're aware that that could be possible. Protect yourself, and watch out for that. So as far as what to look for, there will be a sharp pin prick sensation followed by a dull numbing pain. There will be 2 small fang marks, can lead to severe abdominal pain, headaches, chills, fever, heavy sweating, nausea, and vomiting. Again, those systemic type symptoms. As far as how to treat it, clean it with soap and water, apply an ice pack, give over-the-counter pain medication as necessary, seek medical care ASAP to see if they can get that taken care of, not to see, so they can get it taken care of. If any sort of facial swelling or anaphylaxis occurs, call 911, okay, and treat it appropriately. Again, so this isn't something like you need to go in an ambulance, but you do need to be seen as soon as possible, possibly in the emergency room so that they can take care of you. It's not like, oh, I'll make an appointment for tomorrow. No, like you need to go, okay? Brown recluse spiders, also known as fiddleback or violin spiders. They have like a violin shape on their back. They are a lighter brown to a dark brown color, and they are also venomous. As far as what to look for, mild to severe pain that will happen within 2 to 8 hours. You can get a blister that develops within 48 to 72 hours. It will become red and it will eventually burst. Kind of looks like a bullseye. But you'll also get those systemic symptoms like nausea, vomiting, headache, and fever. As far as what to do, treat the bite the same as you would a black widow spider bite. If the wound becomes infected, apply antibiotic ointment under a sterile dressing and seek medical care. Hobo spiders are treated the same as a brown recluse spider. Okay. Tarantulas. So it's funny, I had a student the first semester I was teaching this class from Kanab, and this chapter was funny because we would go something, I'd be like, well, we don't really have tarantulas around here, and she'd be like, oh, we have them in Kanab. Don't go to Kanab. Apparently Kanab is not a fun place to live. Tarantulas, they only bite when they're provoked or roughly handled. When it gets upset, it will scratch your abdomen. It will scratch its abdomen against the person, and it flicks the hairs onto the person, and they're kind of like cacti. They stick into you, and they have an irritating substance on them, and it hurts. So, as far as a tarantula bite, it varies from mild to severe throbbing pain that lasts up to an hour. As far as treating it, you're going to treat it the same as a black widow spider bite. You're going to get them seen by medical care, and try and give over-the-counter pain medication, try and reduce the immediate reaction. For hairs on the skin, remove it with sticky tape, like when we talked about cacti, those types of things. Wash it with soap and water. You can use hydrocortisone cream in the area to try and reduce the reaction. You can give Benadryl and over-the-counter pain medication as well. So your calm and aggressive house spider bite. So I mentioned a hobo spider. We do have those around here. Look for the same signs as you would of the brown recluse and treat it the same way as you would with the brown recluse spider bite. Scorpions, another thing found in Kanab. Again, why you would live in Kanab, I don't know. Sorry. Scorpion stings. So they look kind of like miniature lobsters, although they look much more demon-like. Stings to adults are usually not threatening, not life-threatening, but to small children it can be very dangerous. So, a scorpion sting will often come with immediate local pain and a burning, can lead to numbness and tingling. If it's a severe reaction, the pain can go all along the arm or leg of the person, can lead to uncontrolled jerking movements, fast heart rates, salivation, so drooling, and breathing distress. As far as what to do, monitor the person's breathing, gently clean it with soap and water, apply an ice pack, give over-the-counter pain medication, apply a dressing to try and keep the wound clean, and if it's a severe reaction, go seek medical care. Centipede bites. So the giant desert centipede is the only U.S. centipede that is dangerous to humans. It is up to 8 inches long, can inject toxic substances, but the venom is relatively weak. Okay. As far as what to look for, it'll be a burning pain with some local inflammation, maybe some mild swelling of the person's lymph nodes. How to treat it? Treat it with, clean it with soap and water, apply an ice pack, give over-the-counter pain medication. If the symptoms persist, give an antihistamine like Benadryl or apply a hydrocortisone cream. If it's a severe reaction, again, seeking medical care. Mosquito bites. Around here in Utah, we do see cases of West Nile that we have to be careful of. But in developing countries, mosquitoes transmit a lot of things. Malaria, yellow fever, dengue fever. I served my mission in Argentina, so I spent 2 years in Argentina, and dengue was something that we were concerned about. Had to get a yellow fever and a malaria vaccine before I left, those types of things. In the U.S., they carry West Nile, Zika, and equine encephalitis. So that is something to be concerned about. Most of us have probably all had mosquito bites. They're annoying, they itch, they swell up a little bit. So there are some people who can be allergic to them, so the swelling gets more severe, but typically it's not life-threatening unless they are carrying some sort of disease. As far as what to do, wash with soap and water, apply an ice pack to try and reduce the inflammation. You can apply a calamine lotion or a hydrocortisone cream for the itching. If you start to get systemic symptoms after a mosquito bite, seek out medical care to try and figure out what's going on. Ticks. So ticks are close relatives of mites and spiders. They can be classified as hard ticks or soft ticks. They're little bugs that they drink blood to grow. They are limited in their ability to find meals or eat. Their bites really don't hurt. Ticks are going to be found here most often in the mountains or in bushes and things like that. Okay. So a tick, this is a pretty good picture of a tick on the bottom here. So it has a head and then it has legs and like a rounded abdomen. The front part has the head and the mouth. It does have barbs to help it like hold in place. Again, most tick bites are pretty harmless, but ticks can carry certain diseases, which we'll talk about. So what ticks will do is they'll bite you and then they'll embed into your skin and they'll keep sucking your blood. Okay. There is not really an initial pain, but it will get a local reaction. It can lead to rash, fever, and chills. Can vary anywhere from a small bump to extensive swelling and even an ulcer. So this is like, this is a finding in Lyme disease. So we'll talk some more about the diseases that you can find, but not everybody gets this, but this is a sign of Lyme disease. So that's something to look out for. For an embedded tick, so you can use tweezers or a specialized tool to grab it and pull it out, but you want to get the tick by the head. If you grab it by the abdomen, the head will come off and it will continue to burrow. So you need to grab it by the head so that you get the whole thing off. So pull it upward and away from the skin. If you do have an embedded tick that you can't get the head of very well, a trick that I learned, in my younger years, I went hunting with my dad a few different places. In Colorado, I got a tick on my shoulder, and the people we were staying with, they took a hot needle and they touched the butt of the tick, and it backed itself out, okay? And that tended to work. So you can try that as well. For a completely removed tick, so if you get it off, wash it with soap and water, apply an ice pack. You can use calamine lotion or hydrocortisone for the local reaction, the itching, those types of things. Place the tick in a bag and take it to a physician. If you get sick, again, if you're not having like systemic symptoms, you might not need to do that, but put it in a bag and throw it away to not allow the tick to escape, because they are slippery little buggers. You could also flush it down the toilet. That can also help. Things like that. Okay, but you don't want to just throw it outside because they'll get on animals. They can get back on you, those types of things. Okay, again, if you're getting systemic symptoms like a rash, fever, flu-like symptoms, seek out medical care. If you're unable to remove the entire tick, if the head comes off, something like that, leave it in place. Treat it with a warm soak and an antibiotic ointment. Most of the time, the body will remove it that way. If you start to get an infection, seek out medical care. So the slide says this. In my mind, if you can't get the tick out all the way, go seek out medical care and let them remove it for you. Okay, because I don't want that tick head in there. It's going to keep brewing and it's going to cause more problems. Okay. So the last things we're going to focus on for this chapter are marine animal bites or injuries. Okay. So most marine animals bite or sting in defense rather than attack. Most of the time they're not super aggressive. Okay. The first marine animal we're going to talk about are sharks. Most shark attacks happen within 100 feet of shore, so that's where most people go to the beach, right? Most people aren't hanging out super deep out in the ocean. They're hanging out close to the shore. So that is something to kind of be concerned about. If you're going to the beach, research if there are sharks prone to the area. Most people are attacked without warning, but again, and most of the time it's in defense, right? Like you're in their territory, so you need to be cautious. Most people are generally bitten on the leg. Sharks are attracted to people on the surface most often versus underwater. So if you're like scuba diving or something like that, typically you're a lot safer than you would be on the surface. Don't swim around fish blood. Sharks are attracted to the chemicals found in it. Okay, so you need to be somewhat careful with that. Barracudas and moray eels. Barracuda bites are very rare. Moray eels, I'm not sure how you say that. They are frequent biters of divers who mess with them. So if you're going to go diving, just don't mess with the eels and you'll be fine. There are some marine animals that will sting. So the jellyfish and the Portuguese man-o-war have long tentacles with nematocysts that will sting you. It hurts. Been stung by a jellyfish before. It hurts really bad. It's not fun. Stingrays, they have a tail with a barb that penetrates human skin pretty easily and it just causes a lot of damage. There's not like venom associated with it or anything like that, but it's very, very sharp like a knife and it will stab you and it's not good. This is actually how Steve Irwin died. If any of you don't remember, rest in peace. Stingrays can be dangerous, so you do have to be careful. As far as what to do for a bite, a rip, or a puncture that's caused by a shark, barracuda, eel, or a seal, monitor the person's breathing, control any bleeding that you can, wash the wound out with soap and water, flush the area with pressure to try and get any debris out, and then treat for shock. Okay, if it's a severe bite, have them seen for medical care, get it taken care of just like you would an open wound. For a sting that's caused by a jellyfish, Portuguese man-o-war, sea anemone, or fire coral, spray or pour full-strength vinegar on the area for at least 30 seconds. Remove any tentacles that are still attached to the skin with tweezers or gloved hands. Soak the affected skin in hot water that's not scalding, not super hot, in a hot shower, or apply a heat pack for 20 to 45 minutes. Over-the-counter lidocaine or benzocaine spray can help with the pain. And monitor the person for an allergic reaction or any sort of breathing difficulty. For a venomous bite by a sea snake, octopus, or a cone snail, monitor breathing, control any bleeding that occurs, apply a pressure bandage on the entire arm or leg, and seek out medical care for any sort of venom or systemic symptoms that are coming up. For a puncture wound that's caused by a stingray, a scorpionfish, a stonefish, starfish, or catfish, Soak it in hot water for 30 to 90 minutes. Remove any debris with tweezers. Wash it out with soap and water and flush with water under pressure. Treat the wound like you would any other open wound. Okay, guys. So, that is our bites and stings chapter. I know that's one of the longer ones we've had in a while. Again, I went through it rather quickly. If you need to, pause, go back, rewind, whatever you need to do to get all the information. Not a ton of information you're going to be tested on, so we're good that way. But this information can be helpful for your life. So if you need to, go back, relearn things as needed. If you have any questions, please feel free to reach out to me. I'm available. Thanks, guys. Have a good one.